this, and it has in fact become very normalized. I mean, if you look at when TV dinners were first introduced, it was a while ago now, and we have now generations and generations of people who have gradually adopted that type of lifestyle. So we've lost some of the basic education and some of the basic skills that go along with healthy cooking and healthy eating in an environment that's absolutely pushing us in the wrong way 100% of the time.
And of course, Bob, I've heard women say, well, I'm going to lose some weight. And then after I lose some weight, it'll be easier to exercise, so I'll start the exercise then. So what would you say to that woman that says, I'll get around to that?
Well, you're right. You cannot exercise your way out of a bad diet. And if you start to put those two worlds together, you will just reap the benefits. And I feel like what I try to tell people in the very beginning is that just start with small changes. Don't try to change everything all at once, because if you do think you're going to get up with all the best intentions, I'm going to eat, broccoli and my brown rice, and I'm going to get on the treadmill, and I'm going to do all these things that I know I'm supposed to be doing. And then all of a sudden by Wednesday, you're like, I'm tired, I'm exhausted, I'm sore. So I think the smaller you start and realize that you're trying to make a complete and utter lifestyle change. And that means this is something that you're going to be doing for the rest of your life. You don't need to have the scale change in these dramatic ways when you first start.
You actually had an automobile accident?
I did. Severe automobile accident where I broke my femur and crushed one of my feet and almost lost the foot. And so it wasn't physically possible. I was months in a wheelchair.
Yeah, you were hit head on by someone who had fallen
Correct.
asleep at the wheel. So now you can't exercise.
Right.
So Bob, how do you help?
I try to tell people, especially if you're dealing with injuries or you're dealing with something that is preventing you from working out, one thing that we all can do is watch everything that we're doing in the kitchen. So if you can't initially get on the treadmill or get yourself out there moving around, what you can do is you can, what I say, work out in the kitchen. You can make sure that you are setting yourself up for success here in the kitchen, as opposed to putting up all these roadblocks for you. I try to get people to clean out all that stuff that you shouldn't be having. We all know what we shouldn't be having, and go from there. Sorry, my dogs are getting a little crazy right now.
So Lou, if you had Becky walk back in, it was like a year and a half that you were really recovering from this accident. Now you have a totally different patient in front of you.
Right. And you got to prioritize her. The main issues is getting back to her level of activity and her level of lifestyle from the accident. So making sure she's getting the physical therapy that she needs, that her pain is controlled. If she's developing depression from all of this, making sure that's treated. And lots of times it sounds counterintuitive, but it's okay to fail, right? So you can try something and fail as long as you retry something again. That's part of the issue also, is once you get back on it, is to set these small goals. But it's okay to fail as long as we try something else immediately.
And I always find that the longer you're off the track,
absolutely,
it's harder to get back on the track. Dr. Campbell, I would imagine a lot of patients that come to you have already gone through, gosh, we don't even know, months, years of this attempt by the time they get to you.
Yeah, I mean, most people who have struggled with this most of their adult life, that it's characterized much of their adult life, this effort and this regain, and this effort and this regain. It's been a lifelong hobby, a lifelong effort, and there's all sorts of emotional baggage, of course, that comes with that. And sometimes people, just to tie it to a few other comments, sometimes people are only willing to take small steps. But I would argue that, after speaking to someone, this is really driven by where the patient is. The patient has to be in the right place for this. But if the patient's in the right place for a major change, to totally overhaul diet, with intensive support program, these behavioral intervention programs that are starting to become more common, so the biggest step they can take may actually be the most useful if that matches their motivation.
One thing that I do with clients, the reluctant client, is I will initially get them to say, okay, we're not going to change what you're eating right now. We're going to change how much of it you're eating. So if I'm working with a morbidly obese person that is living on pizza, burgers, or whatever the case may be, if I get them to just cut whatever they eat in that meal in half, they will start to lose weight. And then that's where the motivation could happen, where they see the number change on that scale. They start to feel lighter and better. And that's when you can go in and start tweaking that diet and say, okay, now that you've lost weight, let's start to reprogram what you're doing. That's one thing that I've been able to do that has become successful for that reluctant person that doesn't want to change anything.
But I want to turn to Dr. Sani, because what we're hearing here is that by the time patients get, to Tom at his weight loss center, that they might be aware of their cardiovascular risk. But let's motivate a bunch of other people out there right now watching and talk to us about the relationship between this weight gain and their cardiovascular risk.
It's entirely significant and related, and here's why. One thing that would be important to address that many people don't know is that rapid fluctuations in your weight, so cycles of rapid weight loss or rapid weight gain, is very detrimental to your cardiovascular health. It's been clinically proven to increase the risk of heart attack and stroke, as defined as cardiovascular events. And so when somebody is struggling with those other risk factors, and just bringing it back to Becky, when she went on those steroids, she was at increased risk of developing diabetes. And now she has that weight gain on her, and now she's developed a motor vehicle accident. And I love that we tuned into depression, because emotional stress eating is very impactful for women and can be a reason why extra calories are consumed. But you have to break it down for patients. You have to tailor it to them. And what I really like to focus on when it comes to my male or female patients is how simple it is. But that takes a very tailored approach. So I often ask my patients, what are you eating right now? Similar to what Bob was saying. And you work with what they're doing, because I need them to believe that if they change how they're eating and they change how they're moving, I can get them to reduce their cardiovascular risk. Studies have shown that if you lose 5 to 10% of your body weight, and you can sustain that over a year, but even in the short term, you can reduce your cardiovascular risk factors dramatically. And I'm talking hypertension, your blood pressure numbers. You can reduce your risk of diabetes, but we actually see clinical lowering of the hemoglobin A1C. And exercise is the most effective way to reduce your triglycerides, as is reducing your carbohydrates in your diet. So when you can show patients these data points, they are amazed.
I'm sitting here